So I've met a lot of you here, I think most people in fact, but I'm Claire Diffey, I'm the manager of SEED, and welcome to our seminar, which we have several a year in this spot here, and try to actually provide seminars of interest to the mental health services and eating disorder coordinators and other people working with people suffering from an eating disorder and their loved ones and carers. So just a very quick housekeeping and then we'll get started on the day. So if you haven't been here before, the toilets are out the door, turn right, just on your left. Today we're going to 11:30, as you know. We're going to have a very brief morning tea break at about just after 10 o'clock. They're not on your seat at the moment, but I don't think Amira's given you an evaluation. We'd like to get feedback always when we're doing seminars from people. So if you haven't got them already, I'll make sure you've got them by the end of the session today. You will have noticed, I'm sure, that we're getting today's session filmed, and a number of you know that we do this, that we particularly want to have this available for the future, and we always get requests from people that are in rural and regional parts of Victoria who can't get to the seminar because they have access to it. It's our way of doing this because we don't have video conferencing, and also it's good to have an actual captured ongoing document of this, so being filmed, it'll be on the SEED website. So pretty much will run smoothly, but I've said to Aaron, who's filming, at any stage if we're doing something that really mucks up his filming, please let us know. So there may be any tiny moment we say, let us know. Including, I've told the presenters they're going to be leg roped to this position here. They can't go waltzing around the room. Okay. And just in case you haven't met all the SEED team before, I'll just introduce them before talking about the presenters today. So if SEED people don't mind standing up, I'll say Michelle Roberton, because she's already standing up at the back. These are all the senior clinicians of SEED. Michelle covers the northeast region of Melbourne and the state. Beth Shelton, who covers the southeastern region of Melbourne and the state. And Matrin Pradel of the actual western region of the state and Melbourne. And Martin has been key to organising today's seminar along with the project group, which I'll talk about. So just giving you a very brief background to how we're here today. So look, all of you will know that kind of support to families and carers of people with mental illness has been, for decades, been an issue that people have been looking at for two central reasons, really, isn't there? That actually helping carers and loved ones understand the illness and supporting them in managing at home decreases their burden and generally actually assist in the recovery of their loved one. So we've got some really, and there's lots of research around that. Even best practice guidelines in Victoria, as they came out last year, were around the recovery orientated framework, and most of you will have seen that, so really emphasising the actual need for carer support and education. And the work and research in this area has been going on for decades really, and particularly in other mental illnesses. Probably eating disorders hasn't had the same degree of funding and research available, but it's really catching up quickly with the work that's happening in the UK and here in Victoria. So we're really interested to actually have this present today around the Building Hope Collaborative Carer Skills Workshop, and we might refer to it the acronym because it's such a long title, and more later about why it's got such a long title. Why SEED's involved in this? I mean, most of you know that our role with actually supporting the mental health services in treating and assisting people with an eating disorder and their families is central to our work, and really thinking about eating disorder recovery has led us to conversations with Ross and Genevieve at Deakin, who've been doing this work, and Eating Disorders Victoria. So from initial conversations led to us coming together as a real collaboration to really talk about the work that's happening to date and ideas about how we could develop this further and make something available in a more systematic and readily available package to people in the mental health services. So today I'm really pleased to be able to present this, having invited all those parties, part of our project collaboration, to present. And we'll be able to talk about the origins of actually the Building Hope work, the research, the work to date in Victoria, and then at the end I'll talk about a package we've developed. Interested to hear your views about how that might be of assistance in your services. So welcome to our presenters for today, and I'll just briefly introduce now and Martin will later. So Genevieve Pepin, who's the, do you mind standing up just for a moment, Genevieve? Senior Lecturer in Occupational Science and Therapy at Deakin University. Ross King, at the front here, Ross, sorry, Associate Professor in Psychology at Deakin University. Rebecca Wickham, who I saw just a moment, oh there you are Rebecca, who's the Family Support Worker at EDV. Is Jane Pitt here? I can't see Jane, she's not here today. Okay, Jane Pitt, I want to acknowledge, she's part of our group, and Jane is the, she's Education Manager at EDV, and Jennifer Beveridge, the CEO of EDV, has also been part of our group, and acknowledge their work in this coming together. And with two other very important people here today, Tracy Dupuy, a carer who has actually utilised this skills in actually dealing with her loved one, and Tracy will come up later, and thank you very much for offering to come today. And Holly Laver, who's been as a facilitator. So we want to hear from actually what it's like to run these groups as a clinician. Okay, so thank you very much, and I'll hand over to Martin now.
I guess the first thing to put in place is to let's sort of get a sense of the landscape around family work across the state, because then we can have a sense of how it might pitch in the Building Hope CCSW workshops in our service system. Because today, the outcomes that we want people to walk away with is, one, you develop more information and understanding about Building Hope and CCSW. Secondly, we'd like you to be able to walk away thinking, well, how does this might fit in our service system? Is it useful? And will it and can it fit into our local service system? And thirdly, we'd like to be able to say, well, this is how we can help you as a consortium of EDV, SEED and Deakin to help you actually integrate that particular approach into your local service. So one is information, and second is interest, and third, and usefulness, and third is how helpful can we support you in integrating into your local service. So in terms of what's actually happening in family work across the state, we know and we're aware that there's a long history in the CAMS and KIMS tradition in systemic family work. More recently, in the last couple of years, there's been a real flow of FPT being used as a first line of treatment in CAMS services. In the adult sector, we know that more recently, in the last couple of years, there's been a real influx of family work in the specialist service eating disorder programs. So at Royal Melbourne Hospital, they have an inpatient and day program single session family work. They also have a multi-family work intervention that's used as part of the day program. And on top of that, they've been doing the Building Hope group in the last 2 years. They've done 3 groups, 2 with EDV and 1 on their own more recently. At Southern Health Wellness Recovery Centre, they offer short to medium-term family therapy intervention, which is around 4 or 5 sessions. And that involves meal support and is an added component to their individualised CBT work. At St Vincent's, there is the support and education groups, and also short and medium-term systemic family therapy there on offer too. And they recently have been doing they did one group, the Building Hope group, recently with EDV. At Barwon Health, there's regular Building Hope groups that have been going for some time. They did a few groups last year with the support of Deakin University. This year, they've run 2 groups more recently, and they're currently towards the end of their second group for the year. And of course, EDV have been doing carer support groups and a number of other initiatives in relation to information support for many, many years, and that has increased over time. So the landscape it's fair to say that the landscape is changing, and it's fair to say that over the last few years there's been an increase in family work across the state. Now, Building Hope and CCSW is one particular intervention that can enhance that particular family work that we're working towards, greater inclusiveness of care intervention in our mental health services. And I guess just to bring you to sort of light in terms of how we've come to Building Hope CCSW terminology, it is quite a mouthful to get your head around at times. But Building Hope was the name that was utilised by EDV, and CCSW is the original name for these workshops from the UK. And when we came together as a group earlier this year, and we've had around 6 to 8 meetings to organise this, as well as a proposal for a trainer-trainer proposal for services, which we'll present at the end of today, we initially went back to CCSW, Collaborative Carer Skills Workshops. But then when we actually spoke to clinicians, and they felt like Building Hope was actually a very good title to attracting recruitment into groups. So we went back and said, let's actually integrate the two. And in true collaborative spirit, our group, we managed to stick with a sort of Building Hope CCSW. We'll refer to it as CCSW in general, but I guess the Building Hope component is to really use that as a recruitment and as a way of talking about the groups towards carers. So with that, I'll hand it over to Ross now, who's going to talk about, give an overview of the CCSW, its history, and also its evidence from overseas. And then we'll move on to getting a bit of a history from EDV around their involvement in delivering Building Hope. And then we'll move into the Victorian statewide research that Deakin University have been undergoing, and they're sort of halfway through that research process. Then we'll have a break, and then we'll come back and we'll have an interview. So this will be another opportunity to get a worker experience and a carer experience of them having come across CCSW. And then after that, Claire will propose and present our proposal, which is a trainer-trainer proposal for services to undertake this particular initiative in their local services.